Hello and welcome to this webinar covering the Medicare Ground Ambulance Data Collection System, or GADCS, Section 7, which is on labor costs and staffing information. I'm Dr. Andrew Mulcahy from the RAND Corporation, a nonprofit organization helping CMS design and implement the GADCS, and I'll be presenting today along with my colleague from RAND, Dr. Lisa Sondag-Padilla. I'll note before we jump in that this presentation is an update of an earlier presentation focusing on labor costs and staffing information in GADCS. That earlier presentation from October 2021 is archived on CMS's GADCS website. The URL is at the bottom of this title slide. Would like to note, though, that some of the questions covered in Section 7 in that earlier presentation have since been updated, and we strongly recommend you review this set of slides and recording rather than that earlier 2021 deck and presentation. Let's kick off with our agenda for the next hour or so. We'll start off with overview of the labor costs and staffing information you'll need to collect and report as part of the GADCS. We'll start off covering two sections in the GADCS, Section 2, which is organizational characteristics, and Section 11, which is other costs, where you might have to enter some information related to labor. These are kind of peripheral sections around the core of the presentation today, and that's on Section 7, which itself has the sole focus on labor costs and staffing. Section 7 split into three subsections, Section 7.1, 7.2, and 7.3. We'll walk through each of these subsections and each of the questions you'll answer throughout all of Section 7 in our presentation today. We'll wrap up the walkthrough of Section 7 with some key points and then move in to an illustrative example. I'll pass it on to Lisa to walk through that example. We'll set the stage by describing a hypothetical ground ambulance organization and then go through all of the Section 7 questions, answering it as if we were that ground ambulance organization. It's important to keep in mind that that illustrative example will use a completely hypothetical organization. The responses that we enter in through that part of the presentation are just for illustrative purposes, and your responses for your ground ambulance organization will certainly be different from the ones we'll talk through during that full walkthrough example. We'll close with a couple of labor frequently asked questions and point you to some GADCS resources. So let's dive into the overview now. As I mentioned, this presentation covers Section 7. I want to point everyone to resources covering not just Section 7, but all of the GADCS. All of these resources are available from CMS's GADCS website. The URL is below. The resources include a printable version of the instrument if you'd like to see in a PDF format the questions in Section 7, a user guide, which is a question-by-question walkthrough in writing of Section 7, a frequently asked questions document that has many questions related to Section 7 and labor, a quick reference guide, tip sheets, several of which are relevant to Section 7, and a video walkthrough of the entirety of GADCS, where you can look at the marked chapters in that video and jump to Section 7 there too. There's also an event website where CMS posts recordings, including this one and earlier ones. Just as a note, back to that title slide, some of them are from 2020 into 2021, and CMS has done some updating of the GADCS instrument since then, which we'll cover on this slide. The original requirement to create a new system to collect data came from statutory language that CMS implemented as the GADCS to meet those requirements. CMS established a GADCS in the calendar year, or CY 2020 physician fee schedule final rule. And after that initial publication of the physician fee schedule's final rule in 2020, there are several rounds of updates, including in 2022, 23, and 24. This presentation, unlike the earlier labor presentation, covers all of the updates finalized through the calendar year 2024 final rule. And for those interested in taking a look at those last round of updates, you can find a link to the PFS final rule at the bottom of your screen. All right, moving on to an overview of the entire GADCS and where labor and staffing comes into play. The GADCS is broken into 13 sections. The first few you have to complete in order, and then after you're able to bounce around from section to section to enter information in whatever order makes most sense for your organization. You'll see 3 of the 13 sections are highlighted in this schematic. The one in dark blue is section 7, where we'll be focusing mostly today. The other 2 in light blue, though, sections 2 and 11, come into play when you're thinking about the scope of the information you need to report in the GADCS in section 7 and elsewhere, like in section 11. So we'll start off covering sections 2 and 11 to give a sense of the scope for labor-related questions in section 2 and section 11. One of the important distinctions to think about is labor costs associated with your organization's staff and employees, as opposed to services that you contract out to another company. So one rule of thumb, if you're paying an annual or over some other period a contractual amount to another company to provide a service like dispatch or vehicle maintenance, those are both cases where the companies you're contracting to provide that service have their own staff and have their own employees. You're not responsible for entering information about compensation and hours worked for the employees of the organization you're contracting to. You do, though, need to report the amount you pay to that other company in total in section 11. So let's walk through a couple examples. For dispatch, many organizations pay a monthly fee instead of employing dispatchers directly. For vehicle maintenance, it's common to have a kind of overall overarching vehicle maintenance contract rather than just paying every time you need work done on your ambulance or another non-ambulance vehicle. Many organizations also contract out billing and hire another company to handle billing for ground ambulance services. In each of these cases, the dispatch organization, the vehicle maintenance organization, or the billing company will have their own staff. And as we'll cover in a second, you should report the total amounts you pay to these contractors to your organization, but you don't need to go and ask them to provide detailed information about hours worked or total compensation. In some instances, your organization might contract out basically all of their ground ambulance operation. Some organizations will contract out for all of their EMT labor or much of their EMT labor. Other organizations will contract out to another company to provide kind of soup to nuts ground ambulance services, including vehicles, staff, equipment, et cetera. So there's an important question at the end of section 2, which covers organizational characteristics. And it's section 2, question 18, and it asks you if your organization broadly contracts out staffing, so providing, say, all EMTs, or a broader provision of ambulance services. If those apply to your organization, you can check one or both of them. If it doesn't, you check none of the above. This is a relatively rare situation where you'd check one of the first 2 options, and it leads to a set of instructions popping up on the screen telling you how to handle that situation. In general, if you're contracting out to another organization to provide broad ambulance services, the instructions will ask you to report hours worked by staff from that contractor, but you don't need to report detailed information on total compensation for those staff. Same thing goes when reporting on facilities and vehicles. You'll be asked to provide some basic information about the types of vehicles or facilities involved in providing this service to your organization, but you won't be required to fill in per vehicle or per facility annual costs. Instead, that expense information in all of these cases gets reported in section 11. So let's talk a little bit about labor costs in terms of just the scope here. The very first question in section 7 asks which categories of staff you use for your organization. And so that question up front, we'll walk through it. It has a set of check boxes. You'll check some off that apply to your organization and leave others blank. Then we'll go into sections 7.1 and 7.2 and 7.3. Those sections ask you to report information about total compensation, total hours worked, and it's total hours worked by activity, as we'll cover. And you've got to do that separately for paid staff and volunteer staff. And the key is that you're not reporting that information for individual staff members, but rather for broad categories of staff, like for all of your EMT basics combined rather than separately. So here's that first question that provides the kind of check boxes for your organization. All of the different rows here for EMT and response staff cover different levels of EMT and response staff, different types. And the columns here represent some different scenarios. You can have paid staff that only have ground ambulance roles and not public safety, like fire or police roles. You can also have volunteer staff that are ground ambulance only. And then you can have both of those paid and volunteer staff that have both ground ambulance and fire, police, or other public safety roles. It's important to note that you'll only see these 4 columns differentiating between role staff with and without roles that are related to fire, police, or other public safety if you report in section 2 that your organization shares costs with a fire department, police department, or other public safety department. If you don't, then you'll just see 2 columns, one for paid and one volunteer. Some organizations will only see 1 column because there's also another question in section 2 that asks if you use volunteer labor in your organization. So if you said, no, we don't use volunteer labor, and no, we don't share costs with a fire, police, or other public safety department, you would only see this 1 column, the first one on the left that says paid staff. It's a great example of how the GADCS questions adapt to your earlier answers to show categories that are relevant to your ground ambulance organization. This is a continuation of section 7, question 1. We're moving away from EMT and response staff now and to administration and facilities staff. You'll see there's some breakdown across categories here: administrative, management, dispatcher call center, vehicle maintenance, facilities maintenance. And there's also a box at the bottom for other not reported above. One of the important steps after filling out that first question is to think about how your staff actually need to get categorized into the different rows in the question 1 table. There's a set of instructions in the GADCS, the printable version and the web-based version, that give you advice on how to handle many different situations that are common. Especially for smaller organizations, it's common for a single staff member to have multiple roles. And to avoid double counting, you want to make sure that each of your staff individually are contributing to just one of those rows in the tables. CMS is not asking organizations to split up that person's compensation or hours worked across rows. So the instructions in section 7 give you advice and directions on how to actually assign each staff member to a given role. The first question is whether or not each of your staff have any ground ambulance roles. And if the answer is no, then they're simply not included. in the information you report to GADCS. If they are, moving down this first yes path in the upper left of this slide, then the next question is, were they paid at any point during your data collection period? So the answer there is either yes or no. If it's no, that staff goes into the volunteer category. If it's yes, then that staff member contributes to a paid staff category. It's a good example of where the instructions help out. If someone transitioned from a volunteer to paid or paid to volunteer position during your organization's 12-month data collection period, there's an instruction to always consider them in a paid category, even if they switched later to volunteer. Within each of these halves at the bottom of the screen for paid staff and volunteer staff, if that applies to your organization, there's another distinction for whether or not they're paid EMT, paid administration facilities, and then volunteer EMT response or volunteer administration of facilities. So you split out along that dimension, and then you pick the most appropriate category for each staff member under those darker shaded boxes at the bottom. The instructions also help deal with many common scenarios here. For instance, if a staff member has both an EMT and an administrative role, you always categorize the person as an EMT. We'll cover a few more examples in a slide or two. Yeah, actually, here are the examples right now. So we have a paid EMT basic, who also performs administrative duties, which I just mentioned, is reported as a EMT basic. A paid EMT paramedic who volunteers, always counted as paid, as I mentioned. If you're, let's see, a volunteer EMT intermediate or advanced EMT who became a volunteer EMT paramedic, you always go with the category at the start of the data collection period. So they'd be marked down as an EMT intermediate. Volunteer to paid transitions, always counted as paid. And then in the bottom sections, bottom row rather, is a good reminder that if it's a staff with only non-ground ambulance responsibilities, like only air ambulance or only fire responsibilities, they're just not included in Section 7 at all. So I encourage you to take a look at that full list of instructions and rules and the Section 7 questions up top. In the web-based GADCS, you can click on a call-out box on the right-hand side of the screen to get a set of instructions that pop up in case you need to refer to them along the way as you're working on Section 7. Moving on to Section 7, Question 2. This is for medical directors, and this question gives you an opportunity to report whether you contract with a medical director rather than employing them directly. So for many organizations, medical directors, clinician, an emergency medicine doc, say at a local hospital or other organization, and they might provide some hours of their time in compensation for a nominal amount. So if that applies to your organization, you don't employ a medical director directly, but you do think of them as a kind of contracted individual staff member, then you can report that here. And it's important for this question to come in here because the very next question, Section 7, Question 3, asks you about all of the labor categories your organization didn't report that they used in that initial checkbox question and the follow-up question on medical directors. So you'll be asked to report why you didn't indicate that you used a labor category. And you can add, check one or more of these. In some cases, your organization just won't have staff in that category. In other cases, you'll have staff in a category, but following the rules and instructions in Section 7, you would have categorized staff that perform that function somewhere else. Like for instance, if all of your administrative staff also go out on calls, following the instructions, you would have reported all of those individuals as EMTs and not reported anyone as administrative staff, which seems odd, but you can respond here and tell CMS that, well, we do have staff that perform those functions, but we followed the instructions and reported them elsewhere. The other one I'll mention is that you do have an other option here, so you can write in your own explanation. In most cases, you'll be able to square your situation with one of these three first bullets. All right, now we'll get into the core of section 7, which is a set of 3 broadly similar subsections. The first one's 7.1 for paid EMT and response staff. And here's what this and the later subsections rather will look like. There's a set of rows going down your screen, and these rows are specific to the labor categories in the broad paid EMT response heading that you selected using in your organization back in the very first section 7 question. So in other words, there's another good example of the GADCS adapting to your earlier responses to only ask questions later on that apply to your organization. So this organization indicated they use EMT basic that do not have a fire, police, or other public safety role, EMT paramedics with a role supporting fire, police, or other public safety operations, nurse, doctor, or other medical staff without public safety role, etc. And then for each of those categories, you're going to report total annual compensation. I'll come back to this grayed out box in a second. You'll report also the total hours worked annually related to ground ambulance operations, to fire, police, or other public safety operations, and then total hours worked related to all other responsibilities. We'll loop back to this gray shaded box here for total hours worked. This is a field that the GADCS calculates for you. So based on whatever information you put in these 3 columns to the right in terms of hours worked for ground ambulance operations, fire, police, or other public safety operations, and all other responsibilities, the GADCS system will add those up to 3 numbers up and report a total here for you. This is a good check if you want to validate the numbers you're putting in against, say, your payroll records. You can look at this total hours worked in the gray shaded box to compare to some of those other data sources. It's important to note that, as I mentioned before, you're never reporting information on individual staff members. Instead, you're adding up all of your EMT basics without fire, police, or other public safety roles. You might have 2 or 20 of these kinds of staff. You're adding them all together and reporting just a single total annual compensation amount and hours worked amounts. I said you'll never report on individual staff, but it is important to know that if there's just one staff member in a category, then you actually will. But that's just by virtue of there being only one staff member that you assign to that category. One other quick note on this slide, you'll see total hours worked annually related to fire, police, or other public safety operations is also grayed out in a lighter gray for some rows. And that's because that column only appears for categories that you report as having fire, police, or other public safety roles. So if you've got EMT, say firefighter paramedics, you'll include them in a category like this one, and then you'll be required to put in hours worked total for both ground ambulance operation and other fire, police, or other public safety operations. The total annual compensation is for all of this individual staff that you've assigned to a category combined, as I mentioned. It includes salary, wages, and benefits like healthcare, paid time off, retirement, stipends, overtime, training time, really anything that your staff member would consider compensation, not just salary or wages, gets included in total compensation. It's important to note that if some of those compensation costs, like benefits, for example, are paid by another entity, like your municipal government, if you're a government-based ground ambulance organization, those must be included when you report total compensation. So in many cases, that might mean reaching out to a HR or payroll group within your municipal government, say, or your broader hospital or whatever your situation might be. If it's a benefit provided by your organization or your parent organization that you're a part of, those must be recorded. This is a quick example of Section 7.1 for total annual compensation. Let's say you have 4 staff that you categorize as EMT or response staff that are paid. You've got 1 firefighter EMT basic, total compensation added up over salary, wages, plus benefits is $20,000. And because there's only 1 person in that category, the amount that you put in this top opening for a response on the right-hand side of the screen is $20,000. So you also had 1 EMT paramedic making $38,000 total compensation. Again, you'd report $38,000. The bottom 2 staff, though, are both in the same category. They're both firefighter paramedics. And say they make $42,000 and $45,000 in total compensation. To get the number you report in the bottom cell on the right-hand side of the screen, you have to add those 2 amounts together to get 87,000, and then that's what you report. For total hours worked, it's very similar. As I mentioned before, you've got to break out hours worked by ground ambulance activities and other activities. And those other activities are separated out one more time. If you're a fire, police, or other public safety-based ground ambulance organization, those hours need to be counted separately. And then everything else goes into this other activities category. That includes air ambulance operation, healthcare delivery outside of ground ambulance, public health responsibilities, community education and outreach, community paramedicine. It really is anything outside of ground ambulance or fire, police, or other public safety. So it's important that the hours worked cover the hours worked related to ground ambulance services specifically. This can be a tough step for some organizations that think about their operations more holistically, covering both, say, ambulance and fire. It is really important, though, because the scope of the GADCS is limited to ground ambulance. It's important to make sure that you're providing some breakout of hours worked for staff that perform a couple functions, hours worked for ground ambulance versus everything else. Some organizations do this based on the share of calls that are medical versus not. Organizations have a variety of ways to make this distinction. The hours worked for ground ambulance operations is not just time on an ambulance or responding to a call, but it's also all of the administrative facilities and management activities. There are a couple of special rules to consider. So on-call time is not included in hours worked unless your staff are at the station present in person, then you can count those hours. One other special rule is that time spent fundraising is not included in total hours worked. And this is a quick example similar to the last one, same 4 staff here of how you tally up and enter hours worked. So for this first employee, we have 1,000 hours worked. They're the only firefighter EMT basic, so that 1,000 hours gets ported over to this upper right cell on the right-hand side of the screen. Same thing for the employee B, the EMT paramedic without a fire role, that 800 hours worked total during the data collection period ports right over to this response on the right, 800 hours. And then for the 2 staff employees C and D in the same firefighter paramedic category, their 1,500 and 1,600 hours get added together to 3,100 hours before being entered in the bottom right on the right-hand side of the screen as 3,100 hours. So as before, you'll have a set of different columns for fire, police, or other public safety operations, and those will only appear when you're reporting hours worked if you say that your organization is fire, police, or other public safety based. This kind of continues the example from before. You'll see that the hours we were talking about earlier are still here, but here we're going to break out the total hours worked for other activities. So we have for this one employee A, firefighter EMT basic, we have 1,400 hours, 1,000 of which were related to ground ambulance services and 400 related to fire, police, or other public safety operations. For the paramedic without a fire or public safety role, this field is grayed out and you're just reporting the 800 hours total worked. And then for the 2 EMT paramedics with fire roles, that split, this is hours worked for fire. You have 250 and 250, which adds to 500. So you'll report 500 here. And finally, there's the all other activities. We already covered what these activities can be. It's important to stress that you should not double report the hours worked supporting fire, police, or public safety operations in this category. So here you might have another, for all other responsibilities, the firefighter EMT basic might have 400 hours worked. The EMT paramedic might have 0, and then the employee C and D could have 50 and 200 or 250 total. So you'd put those hours worked related to all other responsibilities in the rightmost column in the table, and you'd end up with totals across these rows that the system will add up to come up with this total hours worked here. So 1,000 plus 400 is 1,800. We have 800 hours for ground ambulance and nothing else, so that 800 carries over. And then 3,100 plus 500 plus 250 is 3,850. Mentioned this is a good place to check. You want the total of these to be what you have reflected in your payroll or other administrative information in terms of how many hours staff worked. So the system will give you this column, and this is what many organizations will check against their other records to make sure this breakdown is correct as a double check. So I'll quickly go through the rest of the subsections. They follow a very similar format. For section 7.2, question 1, you can see you need to report annual compensation, total paid hours worked, and then ambulance and everything else broken out. In this example, there's only 2 columns here because the 2 categories reported on the left in terms of the row headers don't involve fire, police, or other public safety roles. So that middle column we saw back in section 7.1 doesn't appear here. One other note before I move on, the section 7, question 1, way back at the start of section 7, asks you which categories of staff your organization uses and doesn't use or didn't use during its data collection period. There were a couple of categories for administration and facility staff, like vehicle maintenance, facility maintenance, billing, dispatch, etc. Here, for the purposes of actually reporting total annual compensation and total hours worked, it's just all combined into one category. So you'll have one row for all of your administration facility staff combined, and then a second row for medical director, and that's it. So many fewer rows for section 7.2 than we had for section 7.1, or in that initial section 7 question where you were marking off checkboxes. It's a quick example of a hospital-based provider of ground ambulance services. You might have staff 1 as a clerical staff working entirely on ground ambulance services, maybe payroll, coordinating contracted services. You have a manager working entirely on ground ambulance services. Staff 3 could be a manager working only half-time on ground ambulance services and half-time on other responsibilities in the hospital. Staff 4 could be maintenance, which is 1/4 ground ambulance and 3/4 elsewhere in the hospital. And staff 5 is a medical director. So that's 1/4 the ground ambulance organization and nothing else at that hospital. So this slide goes through how you'd calculate that. And I won't go through all of the details here, but basically for the staff that are 100% ambulance, that total count of hours worked and compensation flows down into what you report in this single row for administration and facility staff. The first 4 of these staff members, excluding the medical director, are all combined into one administration facility staff category. So you have 40,000 plus 60,000 plus half of 6,500 plus 1/4 of 2,000 times 45,000, and that equals your 210,000 and your grand total of 8,000 hours worked across ground ambulance and other responsibilities. For the medical director, it's 520 hours a year. Total compensation is 50,000. And the medical director does work somewhere else, but not at the hospital that runs the ground ambulance organization. So the total hours worked and the amount here in terms of total compensation is just the compensation for work at that organization. Section 7.3, volunteer labor, follows, again, a similar pattern. So one exception difference between section 7.3 and 7.1 and 7.2 is that 7.3 asks you for the number of individual staff who were volunteers during the data collection period. That's important to note because none of the other sections, section 7.1 and section 0.2, actually ask that question. They just ask for total hours worked, but not counts of individuals. Section 7.3 does ask for a count of volunteers. And in a very similar way, you're going to report hours worked, but not total compensation because we're talking about volunteers now across different labor categories. The very end of section 7.3, there's a question about total costs related to volunteers, like stipends, allowances, honoraria, etc. So CMS recognizes that some ground ambulance organizations pay a nominal amount to volunteers, as long as for labor law purposes and tax purposes, staff are considered volunteers, these modest amounts may be allowed. You can report them at the end of section 7.3 as a total sum. And as a reminder, the entire section 7.3 will not appear when you're going through the web-based GADCS unless you've checked in section 2, yes, when you answer the question, does your organization use volunteer labor? I think it's important to remember a few rules here that a staff member that straddles either over time or at the same time paid and volunteer category should always only be categorized as paid staff, not volunteer. If there's a transition, it's always paid, not volunteer, even if they ended as a volunteer during your data collection period. Those nominal amounts get reported at the end. And then as much as you can in section 7.3, any kinds of benefits or forms of compensation that volunteers get during if they're categorized as volunteers should be fit in that dollar amount at the end of section 7.3. There's a separate presentation on volunteer organizations that covers section 7.3 in more detail, and you can find that at the same URL we had up on one of the first slides on Medicare's GADCS website. So let's recap some key points. It's really important to take each of your staff members and categorize them in only one labor category for section 7. Following the rules in the GADCS, the instructions, even if that staff member you're categorizing wears multiple hats in your organization, which may be very common, particularly at smaller ground ambulance organizations. You want to be sure to exclude any staff that don't have ground ambulance roles. So if the staff members' responsibilities are partly or entirely related to ground ambulance operation, they're in. Otherwise, leave them out for the purposes of reporting data to GADCS. One other general rule is to include, if you have staff that straddle an EMT and then admin and facilities roles, they should always count towards an EMT or response staff category. If you have a situation where you're not sure on the administration facility staff side where to categorize a person, you have some flexibility here to use your judgment to categorize an individual staff member into the category that indicates their primary activity at your organization. Staff who were paid and volunteer during the data collection period are paid again. And as we talked about a little bit at the start of this session, if you're paying another company to broadly contract out a service, like all of billing or dispatch, or vehicle maintenance or facilities maintenance, those staff, if they're not employed by your organization, shouldn't be included in the hours worked and total compensation amounts you report in Section 7. They instead go into Section 11, which is for other costs. Total compensation is very broad and covers salary, wages, but also benefits, overtime, training time, many different contributions to the total compensation covered in the GADCS instructions. Some organizations will need to reach out to their municipal government's payroll or HR department to get information about benefits and include those figures in the total compensation costs for their staff in cases when a benefit's offered by your parent organization or an entity that you're also a part of. It's important that if the total costs for a given category, say workers' comp insurance, are only available from another entity, if you only have one number from somewhere else that covers all of your staff, one approach is to allocate that one single amount to labor categories based on salary or wages or some other allocation approach. For reporting total hours worked annually, you want to report hours summed across all your staff in a category. It is all hours that you report, but only at your organization. There's an important split between ground ambulance and then fire, police, and other public safety hours worked, if that applies to your organization. And then there's also an important distinction between ambulance, fire, and other public safety, and then everything else. And those three totals for hours worked during the data collection period get reported in three separate columns. So now I will turn it over to Lisa to do our full walkthrough of Section 7. Lisa?
Thanks, Andrew. Taking what we've discussed, we will now move to providing a complete illustrative example. We will walk through a completed labor section for a hypothetical government ground ambulance organization. All answers are hypothetical and not intended to provide benchmarks for typical costs. Instead, the goal of this example is to illustrate the process of filling out this section of the survey and how different organizations will be presented with different questions. Certain items will be marked not shown, if not applicable to the organization, based on prior response in the GADCS. Please note that the example here may be less complex than your organization. However, this is meant to be for illustrative purposes only. First, we provide some background on this hypothetical organization. It is a government EMS organization with no fire or public safety services. It primarily serves a small city and provides around 2,000 transports each year. The organization provides mostly emergency transports from a variety of payers. They have a mix of paid and volunteer staff. And the organization's 12-month data collection period started January 1st, 2022. Here we provide an overview of their labor structure and contracted services. The organization has 13 EMTs in total, 8 part-time EMT basic volunteers, and 5 full-time paid EMT paramedics. All of the EMTs and paramedics respond to emergency calls and do transports. Occasionally, they do standby events or assist with community outreach programs. One of the EMT basics occasionally performs basic vehicle maintenance, and one of the EMT paramedics started at the organization on March 1st. The organization also has 2 full-time paid administrative staff members and a part-time paid medical director. Note that this organization does not directly employ anyone to maintain or clean their facilities, perform advanced vehicle maintenance, or take the direct emergency calls. Rather, instead, it contracts these services from outside organizations. Note that contracted services should not be reported in Section 7, and instead should be reported in Section 11, Other Costs. Let's walk through how this organization would report information in Section 7, starting with question 1. In this scenario, the only volunteer labor is for the EMT basics, so check yes in the volunteer column. For the paid column, this organization would check yes for EMT paramedic and medical director. The organization does not have any EMT intermediates or other EMT response staff, so these boxes are not checked off for paid or volunteer. We will continue with question 1 on this slide. The organization has paid in-house administrative staff and management, which are checked off. However, the organization contracts with an outside company for dispatch call center activities, vehicle maintenance, and facilities maintenance. Therefore, those categories are left unchecked. As a reminder, all staff should only be counted in one role. Section 7, question 2 asks whether you contract with a medical director instead of employing one directly, and if so, what was their compensation during the data collection period? Because the organization reported in the previous question that they employ a medical director directly, this question is not shown for this organization, and these messages are displayed instead. Next, in Section 7, question 3, for all of the labor categories that you did not check, you will be asked to give one or more reasons why. For the EMT intermediate category, this organization simply does not have anyone in this role, so they select the corresponding option. When you click the plus sign, you will see the same options for each of the other labor categories that you did not indicate you had, as will be shown on the next slide. You will go through these steps for each labor category for which you did not check a paid or volunteer box. As a reminder, organizations may select multiple reasons why a particular labor category was not reported. In the case of vehicle maintenance, some vehicle maintenance is performed by an EMT basic who is already reported using that designation. The organization also contracts some vehicle maintenance out to a repair shop. We now move on to Section 7.1, which asks questions about paid EMT response staff and hours worked. Organizations that exclusively use volunteer labor will not see this section at all. Since our hypothetical organization uses both paid and volunteer EMT labor, they will have to answer questions in this section. Here, the organization only sees one staff category, as this was the only category of paid response staff that they selected back in Section 7, question 1. Their other staff were either volunteer or not response staff. In this table, they first input the total compensation across 5 EMT paramedics, including benefits, which totals $193,100. You can see all of our calculations in the gray box below. Note that one of the paramedics that joined on March 1st, 2022, only worked 10 out of the 12 months of the year, and therefore only has 10/12 of his annual salary and benefits included in this cost. The total compensation across 5 EMT paramedics, including benefits, which totals $193,100. You can also see all of our calculations in the gray box at the bottom of this slide. Note that one of the paramedics joined on March 1st, 2022, and so only worked 10 out of 12 months of the year. And therefore, his annual salary and benefits reflect this in our calculations. For total hours annually for paid EMT response staff, you will not input this number directly. Rather, you will report separately the total hours worked related to ground ambulance activities and total hours worked related to all other activities. The GADCS will automatically add these values to equal the total annual hours worked for your paid EMT response staff. This equals 9,667 hours. Note that these hours include both ground and non-ground ambulance duties. However, this does not include paid time off or sick leave hours if you offer them. In this example, these paramedics spend a limited amount of time doing community outreach, such as running bike safety programs at schools that total up to 40 hours across 5 paramedics. The organization subtracts these hours from the total hours worked to get 9,627 total hours related to ground ambulance operations. They input the 9,627 hours worked annually related to ground ambulance operations and the 40 hours worked annually related to all other responsibilities. The organization confirms that these hours look correct and correctly sum up to 9,667 total hours worked. Now we move into section 7.2, question 1, on compensation and hours worked for paid administration, facility staff, and medical directors. Note that an all-volunteer organization would not see this section. Here, we calculate the costs for administrative staff and a medical director. For this hypothetical organization, administrative or facility staff include 2 full-time paid staff who are responsible for accounting, office management, licensing, compliance, and other office duties. As we said previously, the administrative staff each make $40,000 a year and have benefits equaling to $2,800 per year. Together, the combined total annual compensation is $85,600. With respect to total hours worked, both of the administrative staff worked 2,000 hours for the year, totaling 4,000 hours. All of these hours worked were spent supporting ground ambulance operations. The medical director in this example makes $75,000 in annual salary, no additional benefits, and worked 475 hours during the year. In this example, the medical director works part-time for the ambulance organization and also works at a nearby hospital. However, this work is not associated with the ambulance organization. Therefore, in this case, the ambulance organization does not have to track down her salary paid by the hospital or hours worked at the hospital. The hours worked annually, unrelated to ground ambulance duties, only applies to work done for the ambulance organization. This question asks about specific duties related to ground ambulance operations that may be performed by any staff member. In this example, the organization has staff members performing all of these duties. However, with the exception of billing, none perform them more than 20 hours a week. For example, the billing administrative staff occasionally do data analysis, but not more than 20 hours per week. The EMTs will train new EMTs, but not more than 20 hours per week. The medical director spends most of her time at the ground ambulance organization on quality assurance, but only works 9 hours per week total. So in this case, the organization answers yes for billing, but no for data analysis, training, and medical quality assurance. This slide starts the section on volunteer labor. If your organization does not use volunteer labor, you would not see this section. Here, you will report the number of individuals who are EMT response volunteers within your organization. So for this hypothetical organization, the number of individuals is 8. Moving on to the next slide, for question 2, you need to report the total hours that these EMT volunteers worked during their data collection period. To do this, the organization added up the total hours worked by each EMT. In this example, they have 8 part-time volunteer EMTs who worked between 15 and 20 hours a week. First, you would report total hours worked across the 8 volunteers. This totals 6,750 hours. You can see our calculations in the gray box below. At this organization, the volunteer EMTs spent a total of 50 hours during their data collection period doing public health outreach activities, with the rest of their time spent on ground ambulance-related operations. The organization inputs 6,700 under total hours worked annually related to ground ambulance operations, and 50 under total hours worked related to all other responsibilities for EMT basics. The total hours for all volunteer EMT response staff serves as a check. The organization will not see questions 3 through 5 about volunteer administrative and medical director roles because they have previously indicated that all of their staff in these roles were paid. Moving on to the next slide. Question 6 asks about stipends, honoraria, benefits, and other types of compensation for ground ambulance labor. This organization provides a $500 stipend to volunteers each year and paid $6,000 in workers' compensation insurance for the volunteers. $500 times 8 volunteers, or 8 volunteer EMT basics, rather, equals $4,000. And 4,000 plus 6,000 equals the $10,000. So this organization would answer yes to question 6 and input $10,000 for question 6A. That brings us to the end of our example. We now wrap up our discussion with some information about the FAQs. So in addition to this presentation and others, CMS has created an FAQ document that is available on the GADCS website. This FAQ document has frequent questions and answers on all aspects of the GADCS, not just labor. Some examples of the labor-related FAQs, all of which were discussed during this presentation, are listed here. Please note that this slide references a version of the FAQ document last updated on November 2nd, 2023. And that document is periodically updated, so please visit the link at the beginning of the presentation for answers to the latest FAQs. And for any other questions related to the GADCS, please visit the CMS GADCS website, which again is listed on the overview slide of this presentation. That brings us to the end of our presentation. Thank you for your time.